Hey all, I'm Venus Singh, a health coach at Besugarfit. Today I'm going to take you through a starter's guide to continuous glucose monitoring. Sometimes diabetes can be overwhelming. You have to monitor your diet, activity, stress levels, sleep, along with simultaneously calculating and managing carbohydrates to keep tabs on your blood sugar levels. In this session, we are going to explain that CGM is a continuous glucose monitor. How is CGM used and how can you use the data obtained to help you manage and navigate your journey towards diabetes reversal? It's a process that continually monitors your blood glucose levels or your sugar levels through an external device that's attached to your body to give real-time updates on your blood glucose patterns and trends. A blood glucose monitor is a finger-stick blood glucose meter which provides measurement of blood glucose levels at a specific moment in time. That is, when you prick your finger. Whereas a continuous glucose monitor, which is a CGM device, typically generates a new glucose value every minute and records the reading every 15 minutes. A blood glucose monitor is similar to a photograph, providing a single blood sugar, that's a snapshot of your blood sugar reading. CGM is like a video, providing constant stream of information on the glucose level, trends, and overnight data. CGM measures the blood glucose levels in real time by sensing the glucose present in tissue fluid. This is also called as interstitial fluid. Now, a sensor is placed on your skin and it transmits those readings in small recording device called a receiver. The CGM device has three components. One is a sensor, the second is a transmitter, and the third is a receiver. The sensor consists of tiny probe that is inserted under the skin of upper arm using a simple applicator. Once placed, the device continuously records your glucose levels throughout the day or night for a duration of 14 days. The transmitter sits on the top of the sensor and is attached to an electrode that sends glucose information to a separate receiver or a smartphone application. The receiver displays real-time glucose level, whether blood glucose level is trending up or down. The AGP report, the blood glucose reading from the CGM device, is then converted into a standardized report called as ambulatory glucose profile report, which gives us a detailed picture of your 14 days readings and includes a summary of glucose profile, daily glucose graphs, and the times you measured above and below your target range. Developed by the International Diabetes Center, an ambulatory glucose profile report is a standardized way of reporting continuous glucose monitor data. It's a tool that provides a simplified way to look at data on your blood glucose patterns and trends based on at least 7 days to 14 days of the CGM data. CGM plays a vital role when it comes to predicting your current level of metabolic fitness, thus helps in positively influencing improvement for your future metabolic health. It allows you to keep a real-time check on how your body is functioning by offering you instant metabolic data to make necessary changes to your lifestyle and reduce the likelihood of a surprise diagnosis later in life. CGM are particularly useful after meals and overnight as they record when glucose levels drop or rise below the preset threshold. CGM provides a good way to monitor the time spent in range, the time spent within a normal level pre-specified blood glucose sugar range. For people actually having trouble reaching and maintaining the target blood sugar, CGM can be really useful. CGMs are particularly useful if you often have lows, episodes of hypoglycemia, and are unaware of when that happens. So, hypoglycemia unawareness can be addressed by the use of CGM. The AGP report allows your healthcare team to assess blood glucose levels, trends, and patterns, thus helping identify the times of the day when the blood glucose are consistently low, high, or fluctuating. The general goal for individuals with diabetes is to have glucose levels stay within the range of 70 to 180 mg per dl for at least 70% of the day, and spending less than 3% of their time in hypoglycemia, which is under 70 mg per dl. This information from an AGP report helps your doctor set relevant goals for your diabetes management by providing care that's more precise and effective. At the end of the day, any data is meaningless if it cannot be interpreted correctly or is not used by the provider to aid in the diagnosis and a more focused treatment approach. Remember, the CGM is a personal tool and not necessarily a single aspirational target or the range that is universal. Your individual goals will depend on your needs and dietary and lifestyle habits. Your comorbidities, your complications are also a causing factor. Based on your unique presentation and recorded CGM data, your doctor will educate you on how to interpret and use your data to make the appropriate decisions to achieve the blood sugar level goals. Thank you.